It's truly remarkable the role the community health centers played in Massachusetts healthcare reform.
Healthcare reform has been pretty dramatic in Massachusetts and has enabled community health centers to serve many more patients than we had served before, particularly the uninsured.
I think the reason why the state is almost at 100% coverage is because of the outreach and enrollment efforts that health centers performed over the past 5 years.
In the very first 2 years of implementation, health centers served as the primary source on reform in both urban and rural areas.
This was the result of health centers being known for quality, cost-effective care.
So the League, Healthcare for All, and the Mass Hospital Association approached the state together and said, let's do a campaign of outreach and enrollment for both those that are currently using the free care pool in hospitals and health centers, but also those that might not be accessing benefits at all.
One of the most gratifying parts of the health reform was that our patients remained with us instead of going to other providers, even though they now had health insurance. What's more, health centers ended up gaining over 150,000 new patients during the law's implementation.
Massachusetts was fortunate to receive more than $200 million under the Affordable Care Act, and that was to see additional patients and to actually build a number of new health centers and renovate existing health centers. So that's made a huge difference in the number of patients that we can serve.
Many people now realize getting an insurance card is not enough to ensure access for people in the state of Massachusetts. What really was needed are primary care physicians in locales that were of comfort to patients.
Medical students, particularly those that would love to go into primary care, are often faced with huge school bills. And the challenges of repaying that huge amount of debt has created significant challenges for community health centers to recruit primary care providers. Sometimes we're not able to pay those top dollar salaries that some of our counterparts could.
The League partnered with Bank of America, Blue Cross Blue Shield of Massachusetts Foundation, partners, Neighborhood Health Plan, the Commonwealth, and the League itself to start this loan repayment program that has allowed the health centers of Massachusetts to hire an additional 88 physicians and 34 nurse practitioners, expanding access to care for their patients.
When I sit down with a new patient, I want to first establish a relationship with them.
Hello, I'm Dr. Jordan. Nice to meet you.
Nice to meet you. I want them to understand that we're working together on their health.
You know you need to get your thyroid checked, right?
What Dr. Jordan has that really great leaders have is the ability to connect to people.
I'll ask them about themselves, I'll ask them about their families, where they live, what they do, whether or not they have all the means to be able to afford food, their utilities, their medications, and really get a sense of what their understanding of their disease is.
I think she's really a leader among the health center physicians.
She's smart, savvy, hard worker, industrious, and she's fun to work with.
One of the reasons that I started at Dimock was the staff. When I walked in and saw staff that had been there for 20 and 30 years, it really just pulled me in immediately and made me turn around and tell my husband that we were moving to Boston from Baltimore.
The campus where Dimock is located has been providing services for 150 years continuously. And I think if the leaders that had the original vision for this campus were able to come and look at what's going on campus today, they would be so impressed with her clinical leadership and the types of services that are being provided on the campus.
And we just recently have received a $4.9 million grant from the federal government for renovations in the health centers. Watching her work on that and the success that we had as a result of her and many other people's work at Dimock is just very rewarding.
A community health center is a vibrant place where you can impact so many. People walk home feeling like they've helped Mr. Jones get their medications. They've seen Mrs. Johnson at her lowest, but they've also seen her rise up to her highest after she's gotten her GED, after her kids have gotten into Head Start. The community really is what drives the programs and drives who we are. It's sort of a love-love relationship between the community and the health center. You have to be part of it to understand it, and once you're part of it, it's hard to leave. I go home with a sense of feeling like I've done something important.